All right, this is the second video lecture for Chapter 40, Anticoagulants, Antiplatelets, and Thrombolytics. We're starting with antiplatelets. So how do antiplatelets work to help with preventing clots? Their action is that they suppress platelet aggregation. They're used to prevent thrombosis in arteries, prevent MI or stroke in the patients with familial history, prevention of repeat MI or stroke, and prevention of stroke for patients having TIAs or transient ischemic attacks. The first antiplatelet drug that we'll talk about is aspirin. We've already covered this. This is one that you have to recognize as an antiplatelet drug. It's effective and inexpensive. Usually is prescribed at low dose therapy. How does it work? It inhibits that COX enzyme needed by platelets to synthesize thromboxane A2. So in order to cause platelet aggregation, they need that enzyme. It's used in the prevention of MIs and thromboembolism and the prevention and treatment of strokes. It's important to know that aspirin, one thing to know about it is aspirin should be discontinued at least 7 days before surgery. Before we go to thrombolytics, I'm going to stay on antiplatelet drugs because there's not a slide, but we need to talk about clopidogrel, which is your prototype drug on page 588. Clopidogrel bisulfate is an antiplatelet, brand name Plavix, if you heard of that. It's an antiplatelet drug frequently used after MI or stroke to prevent a second event. It's been stated that clopidogrel and aspirin are more effective in inhibiting platelet aggregation if used together than if used as separate antiplatelet therapies. Looking at some information about it, prevents platelet aggregation by binding of ADP to the platelet ADP receptor. Again, just like aspirin, should be discontinued at least 7 days prior to surgery. Should not be taken if the patient has a bleeding peptic ulcer, any active bleed, or intracranial hemorrhage. And again, you have a prototype chart for clopidogrel on page 588 that you'll want to review. Next, we're moving to thrombolytics. Again, of the classifications that we have talked about, thrombolytics is the only one that's actually going to break down a clot. How does it work? It binds to the fibrin, promoting conversion of plasminogen to plasmin. The plasmin digests the fibrin in the clot, degrades fibrinogen, prothrombin, and other clotting factors, disintegrating a clot. So thrombolytics are considered clot busters. Side effects, adverse reactions to be watching for: anaphylaxis, dysrhythmias, and hemorrhage. If you look at page 589, your prototype thrombolytic drug is alteplase. Commonly you'll hear it called TPA, but alteplase is the drug that you will want to recognize as a thrombolytic. Thrombolytic drugs should be administered within 3 to 4 hours of a thrombolytic stroke. So if the stroke's being caused by a drug clot, that thrombolytic drug administration needs to happen within 3 to 4 hours of the stroke. Looking under side effects and adverse reactions, we talked about a couple. The major complication of this thrombolytic drug classification is hemorrhage, which makes sense. The anti-thrombolytic drug aminocaproic acid is used to stop bleeding. So the antidote for alteplase is aminocaproic acid. If you look at your small purple chart on 590, again, the thrombolytic drug that you need to know is alteplase, which is your prototype drug. And of course, you do need to know its antidote, which is on that purple chart, aminocaproic acid. So looking at the purple nursing process box, I'm going to let you look that over on your own. A couple of things, obviously, we'll be monitoring for bleeding. Monitor vital signs. Increased pulse rate followed by decreased blood pressure usually indicates blood loss and impending shock. So we're going to be watching for decreased blood pressure and increased heart rate when we're looking for rather while we're monitoring our vital signs and looking for signs and symptoms of bleeding or hemorrhaging. Let's see. Examine the patient for an active bleed, for active bleeding every 24 hours after a thrombolytic therapy has been discontinued. So it's not just during the therapy, but up to 24 hours after therapy has been discontinued. This should be done every 15 minutes for the first hour, then every 30 minutes until the 8th hour, then hourly. Watch for allergic reaction. Avoid NSAIDs and aspirin while taking the thrombolytics. Monitor ECG for any dysrhythmias as a clot is dissolved. And avoid venipuncture, arterial sticks, any invasive procedure while the patient is receiving the thrombolytic treatment. So review that nursing process box. We highlighted some things, but you want to look it all over. And then if you want to do the end of the PowerPoint questions on your own, and we will discuss those in class.